thank you so much for being here and advocating for comprehensive health care reform in America. And I have never been more optimistic than I am right now with President Obama in the White House and a Democratic House and Senate who shares our vision for health care reform, for universal health care. This is the year we're going to fix this crisis once and for all. This is where it is right now. We have made the progress that we've made because of the grassroots effort across the country, with average citizens really coming together, saying enough is enough, that we have to fix health care in this country, that it's becoming more and more unaffordable in America, and we can do better. The health care, is a statement that we're making, is a right for everyone, not a privilege for just a few. And I think this is obviously something that's long overdue in addressing. We've been following this issue for many years, going back to the days when the Clintons first started it and made that first valiant attempt. But this is the year we're gonna finally fix it. My principles for universal health care, and I know you share them, as a program that guarantees access to coverage regardless of health status or pre-existing condition, increases choice of doctors and health plans, improves patient safety and quality of care, provides affordable coverage for individuals and employers, allows continued coverage when you change or lose your job, invests in preventative and wellness programs. And I think that's something that's vitally important and often overlooked. You know, one of the reasons why we have the highest costs in health care and the worst outcomes in comparison to any other industrialized nation around the world is the fact that we have probably more now than 47 million Americans without universal health care coverage. So that when you aggregate those costs and outcomes across the entire population, you have such a significant block who doesn't have access to that early preventative care. And so what you wind up having is people who without coverage and they wind up having to go, they get so sick that they have no choice but go to the emergency room, go to the hospital, where they're going to be treated, but it's probably at the end stage of an illness when they're so sick that they have no alternative but to go to the emergency room, go to the hospital, and then they're probably going to be hospitalized, or their condition is far more complicated and requires much more comprehensive long-term care. So if you had access to healthcare professionals early on, you could go and get your problem taken care of. It's going to be far less expensive. In addition to the fact that if the insurance that you had access to provided support for wellness programs and early preventative care, early screenings and that type of thing, that we'd avoid the longer-term complications that comes with ignoring healthcare problems that again could have and should have been addressed early on. The other thing that is vitally important as part of my principles that I need to see in healthcare reform is creating a strong healthcare workforce. Obviously, as Dan knows, we need to have obviously support for trained professionals, whether it's CNAs or nurses, the doctors, primary care physician. Principles that I need to see in healthcare reform is creating a strong healthcare workforce. Obviously, as Dan knows, we need to have obviously support for trained professionals, whether it's CNAs or nurses, the doctors, primary care physicians. Obviously, going to be very important in this healthcare reform effort. We don't have enough primary care physicians right now, which is a problem. We are going to have to work to incentivize support for more people going into nursing programs, and that means things like making sure that we have enough instructors to teach the new nurses coming in. It's not that I found that not that we have a lack of interest in people wanting to go into nursing programs. It's the fact that there's such a long waiting list because we don't have the instructors or the facilities and the right support and structure to support a larger increase in expansion of nursing programs. So we have to incentivize people to want to teach, and that's a problem when a first-year nursing student can basically earn far more than a nursing instructor. It doesn't incentivize trained nurses to want to come back and actually teach the next generation of nurses. So we have to make sure that we're incentivizing those type of programs so that we do have enough instructors and the support there, as well as also looking at primary care physicians and encourage more doctors to go into primary care. I think we can do that by making sure that primary care physicians are adequately reimbursed and that we also make sure they're not coming out of medical school with mountains of debt. I think if we can address those two problems, we're going to encourage more doctors to go into primary care. And I've, talking to doctors over the years, that's among the most rewarding areas of their field of practicing medicine, is when doctors can go in and practice real primary care. But when you're struggling to just you pay medical bills and also keep the lights on, you're not adequately reimbursed because the reimbursements are so low because of the health insurance carriers are in the driver's seat, and they have a monopoly basically, and doctors don't have adequate negotiating ability. In addition to obviously consumers not having adequate bulk purchasing power to negotiate, the system is just out of balance. So we can do better, and so making sure that we have enough support for primary care physicians will be vitally important. Finally, one of my last principles, although I guess wasn't one of the key ones, maybe I shouldn't say the last, but one of the primary ones will be reducing long-term growth of healthcare costs for businesses, governments, individuals, and families. So we obviously have to address and look at the real rising costs of healthcare, and eliminating things like duplication of tests, making sure that we're making extensive use of IT, medical records. These are the things that will help to reduce medical errors and deliver ultimately better quality of care. So these are the things that we're looking at, we're working on. As you know, that the House just kind of gave more form to its healthcare proposal and creating these health insurance exchange. I have long advocated for using a public plan as kind of a template. I've looked at the Federal Employees Health Benefits Program as the model for universal health care in America, and I've introduced my own legislation modeled on the Federal Employees Health Benefits Program as the template for universal health care. FEHBP is not a big government-run program, but it is government negotiated. It uses the bulk purchasing power of the federal government on behalf of the almost 9 million federal employees, dependents, and retirees to negotiate using bulk purchasing power with health insurance providers to get the very best deal for the consumers that are in FEHBP. I think this is the template for universal health care that I've long advocated for, and I believe that the American people deserve the same kind of health care coverage as members of Congress. It's the right thing to do, and I think it's a good template. So as far as I'm concerned, it is a non-negotiable issue that we have to have a public plan as a part of this health care reform solution. That's what the House plan includes. I know that the Senate is working in that direction too, but I believe that that's how it's going to look at the end of the day. We're getting much closer. The Speaker has said she wants a bill passed by the House by or before the August recess. I think we're on track to do that. Hopefully the Senate will match that time frame, that we would be then in conference committee in the fall with the bill to be on President Obama's desk before the end of the year. Time has come. Let's get this done. Thank you all very much.